Hi, this is Dr. Christopher Maloney talking to you about adrenal fatigue, which is a disease that doesn't exist according to conventional medicine, because truly I had a patient who was an adrenal failure, and for a period of 2 weeks, for every hour, on the hour, 24/7, we kept him alive with a spoonful of peanut butter and honey. And after 2 weeks, the conventional medications, one of the older docs said, you know what, this could be adrenal failure. They gave him supportive adrenaline, and which is cortisol, and he was fine. But the point was, it took them 2 weeks to recognize Frank a failure. This guy was passing out, falling on the ground. It took them 2 weeks to recognize that. So when you talk about adrenal fatigue, the only test that we have conventionally for that is a a blood shot of, is your cortisol within a range of 18 to over 200. You're not going to catch adrenal fatigue until it just becomes adrenal failure. So for the most part, adrenal fatigue is something that we all experience at some point in our lives. We've all gone through all-nighters, or we've done something, or we've worked night shift for, there's always some period of adrenal fatigue. That's not what I'm talking about. It's not a short-term thing that you recover from, you sleep it off. But it is something that shows up, the person is doing the right thing, they should have recovered, but they're not. And at that point, what's happened is there's a dysfunction in how much cortisol their body's generating when it's generating that cortisol. It's pretty easy to check, but you need to do a 24-hour check. You can't just do the quick blood draw. You need to do a 24-hour check, and it's pretty easy to document that. And then it's actually fairly easy to treat that if that's the only issue that someone has. But the problem that I have is that people rarely just have that issue. They have adrenal fatigue, and then they have thyroid issues, or they have a range of other illnesses that they're having at the same time. So it becomes very complicated to treat on its own. I don't think that just treating adrenal fatigue is ever really curative. It's when I fix the people that have adrenal fatigue, and they go on about their lives and do other things that are not beneficial to them, I feel like we've basically masked a symptom of a larger issue. And what you really want to do is live a life where you don't need to constantly treat yourself or retreat yourself for adrenal fatigue. So it's the life-changing idea that you want to do. You want to change the whole life around.